Hi, my name is Veronica Sanchez, and this is my body system presentation over vision and hearing. With changes in geriatric population, so vision and hearing loss are particularly prominent in the older adult population. Vision changes affect visual acuity and accommodation, which basically means the ability to adjust to changes in environmental light. Changes in vision can begin early on and don't always necessarily happen when someone reaches a certain age. While vision has a negative impact on a person's perception of the world, hearing loss diminishes a person's mode of communication and can lead to social isolation, which is expected when you don't have a good sense of hearing. You can feel separated from the outside world. 80% of people older than 85 experience hearing loss. Aging is the most important risk factor for hearing loss. It is also the third most prevalent chronic condition and the foremost communicative disorder of older adults in the U.S. So with a hearing assessment, a patient may expect to be asked about a focused history, and they're going to go through a physical examination and maybe some screening assessments. The physical examination can also indicate impaired transmission of sound waves to the brain, thicker, drier cerumen, which is basically earwax, and typically people see in men that the ear appears larger with coarse hair and wrinkles. So some of the hearing assessment questions a patient may be asked includes, do you have difficulty understanding speech in noisy situations? Have you been exposed to prolonged noise? Have you had any past injuries that could have potentially impaired the hearing? Do you use potentially ototoxic medications? And do you have to strain to understand a conversation? So some of these questions can bring to the surface, okay, we're having hearing issues, what can we do to help it out? Hearing screening assessments. So here are just a set of some screening assessments, and I'll go ahead and go through them. So there's the whispered voice test. So the examiner is going to stand at arm's length behind the patient. The opposite auditory canal is occluded by the patient or examiner, and the tragus is rubbed in a circular motion. The examiner exhales and whispers numbers and letters, and if the patient responds correctly, then they go ahead and pass. Next, we have the finger rub test. The patient closes their eyes, and the examiner rubs their fingers 3 to 4 inches away from the patient's ears. The patient must acknowledge the sound to go ahead and show that they're able to hear the slight noise. Now we have the watch tick test. And so the examiner is going to hold a ticking watch next to the patient's ear and ask them to note when the watch sound disappears. This can indicate whether they're having a hearing issue or not. There's also the hearing handicap inventory for the elderly screening version. There's the handheld audiometer, and there's also the Rhine and Weber tests. Now for the vision assessment, a patient can expect to be asked some assessment questions. There's going to be a physical examination, probably a focus history, and some vision assessment screenings. So with the physical examination with older age, you might see light scattering increases, maybe their color perception decreases, and they may have an increased sensitivity to glare as well. So some of the vision assessment questions a patient can expect, this can include cloudy, blurry vision. Are you having any eye redness? Any pain in the eyes? Are you having severe headaches, maybe some mild headaches? Are you experiencing light flashes? Do you have a decreased mucus production? Do you by chance wear glasses or contacts to help you see on a day-to-day basis? And are you experiencing nausea or vomiting? So redness and pain in or around the eyes, along with severe headaches, nausea, vomiting, can also indicate a medical emergency, or these symptoms can possibly cause blindness. So one of the main vision screening tests, and I know we've all seen them today, we see them when we go to the eye doctor, we see them when we go to our pediatrician or our normal doctor. So this is the Snellen chart. So this chart includes 11 lines. Each line has a different size letter, and there's a large E at the top of the chart. So basically they're going to ask you to cover one eye and go ahead and read the letters and see how far you can get down the list before you can't read it anymore. This can go ahead and show the doctor or the examiner how well your vision is. So now we have pathophysiology of hearing. So there are many hearing disorders that people go through today. This includes sensory neural hearing loss, which is caused by damage to a part of the inner ear or neural pathways to the brain. There's presbycusis, which is the most common form of hearing loss related to age. There's noise-induced hearing loss, which is caused by continuous noise exposure. Cerumen impaction, so this is one of the easier treated disorders. It's basically when there's a lot of earwax in the ear, and one of the main treatments is just removing that so the airway is open. And then there is also conductive hearing loss, which is caused by an abnormality of the external or middle ear that impairs the sound transmissions to the middle ear. Now for the pathophysiology of vision. So some of the vision disorders that people see today are cataracts, glaucoma, diabetic retinopathy, and diabetic macular edema. So cataracts are the leading cause of blindness in economically challenged countries. Glaucoma is a group of diseases that can damage the optic nerve. Diabetic retinopathy is a disease of the retinal microvasculature characterized by increased vessel permeability, and the most common cause of visual loss attributable to disease or diabetes is diabetic macular edema. So some of the education points for hearing loss, there are hearing aids, which are great devices to look into. There are lip or speech reading classes, so this can go ahead and help the patient understand and communicate with other people, understand what's going on in conversations, and give them the practice of being able to read someone's lips instead of having to rely on the hearing. You want to avoid exposure to excessively loud noises. You want to go ahead and ask family and friends to face you when they talk to you so you can see their faces, and this is when the lip or speech reading comes into play. If you can physically see their lips moving, this can help you understand what they're actually saying. And you also want to ask people to speak louder but not shout. Shouting isn't going to help, and it's not going to do you any good. And then you also want to avoid injury with cotton tip applicators. So we use these on a day-to-day basis. We use Q-tips, so you want to make sure not to push the Q-tip too far into your ear, because doing so can cause damage into your inner ear. And some education for vision loss. So the American Optometric Association recommends taking caution when driving. This also includes using caution at intersections. You want to reduce your speed so you're not driving too fast. You want to limit yourself to daytime driving. It may be hard to see at night, and so if you're only driving in the daytime, you can go ahead and save yourself from the complications or the hardships of driving at night. You want to avoid wearing sunglasses, which is just going to decrease the amount of light in your vision. And there's also driving courses for seniors, which can also help with driving tips. There are low vision rehab services, and there are also prescribed devices. So a couple of prescribed devices include spectacle mounted magnifiers, which is good for completing close-up tasks like writing a letter. And there are also handheld and stand magnifiers. So these are for short-term reading tasks. So you want to use large type books when reading. It really helps when the letters and the words are bigger, so you're not having to strain with your eyes. You want to wear safety eyewear when working around the house or playing sports. And you want to go ahead and go to annual eye examinations to go ahead and see how your eyes are doing, if they're progressively getting worse, if you're at a good state, and this will give you a good indicator of where you're at with your vision. And these are my resources. Thank you.